Good afternoon. Today we have a special media briefing prepared with a guest speaker joining us. Dr. Douglas W. MacPherson is a trained and qualified in internal medicine, medical microbiology, clinical tropical medicine, infectious diseases, and he is an expert in international public health and outbreak management. At St. Thomas Elgin General Hospital, Dr. MacPherson contributes to clinical patient care in infectious disease and hospital programs. We welcome Dr. MacPherson to our media briefing today. I will now hand it over to Dr. Locke for an update.
Thanks. So good afternoon, everybody. I'll start today's media briefing with a look at our most recent data. Today we have 20 new cases, bringing our active cases to 136. This is higher than we had a week ago, meaning we are not moving in the right direction. Variants of concern make up 67% of our active cases at the moment. We have 2 ongoing institutional outbreaks. Crescent Care Woodstock has 4 residents and 6 staff cases. Tillsonburg District Memorial Hospital has 12 patients and 5 staff cases. The variants of concern are a factor in the hospital outbreak. 15 residents of the Southwestern Public Health Region are hospitalized and 6 are in the ICU. On the prevention front, by the end of today, 80,000 residents of the Southwestern Public Health Region have now received at least 1 dose of vaccine, which is approximately 38% of the total population. At the provincial tables, there are significant conversations happening about 12 to 15-year-olds and their eligibility for Pfizer, as the Pfizer vaccine was recently approved by Health Canada for that age range. Please watch for updates on their eligibility. Locally, our vaccine supply is increasing substantially, which I know is welcome news for residents, as it means a whole lot more of you can be vaccinated. Earlier this week, at-risk health conditions and Group 2 essential workers became eligible. And tomorrow at 8 a.m., anyone aged 40 and over will become eligible. The easiest way to book is online. I've been asked to share a user tip for those with an Apple device. Make sure your operating system is up to date. It will make your booking experience a much better one. In addition, highest risk healthcare workers may soon book their 2nd doses sooner than originally anticipated. The people on this list faced a high risk of COVID-19 infection due to their exposures in work or care settings. This includes frontline hospital staff, those working on the COVID response in assessment centers, labs, and vaccine clinics, medical first responders, long-term care and retirement home workers, and some community health workers. These workers will get more information from their employers shortly. They cannot rebook an appointment online, only through the telephone booking system. The topic of AstraZeneca is on many minds today following the Ontario government's decision to stop offering first doses effective immediately. The Ontario Science Advisory Table, provincial and federal partners, and our colleagues at Public Health Ontario have been monitoring the data carefully, and when they observed an increase in a rare blood clotting condition, they made the decision to pause the rollout of the AstraZeneca. I want to acknowledge the impact of this message on those who received the AstraZeneca vaccine and who may be feeling anxious and worried about their health or what lies ahead regarding a second dose of this vaccine or another vaccine. I don't have further updates at this time, and I don't want to speculate. We will wait until the National Advisory Committee on Immunization and Ontario's Science Advisory Table analyze provincial, federal, and international data and make recommendations for us to follow. When we have more information, we will communicate this broadly. So that concludes my prepared remarks. I will now hand this media conference over to our special guest, Dr. Doug MacPherson, who joins us from St. Thomas Elgin General Hospital. As you heard earlier, Doug is a trained and qualified internal medicine and medical microbiology, clinical tropical medicine, and infectious disease expert. He's also expert in international public health and outbreak management, and we are very pleased to have him here with us today. Handing it back to you now, Natalie.
Thank you very much. And we will also spotlight Dr. MacPherson.
Good afternoon, and thank you, Joyce, and thank you to your team for the invitation. And thank you to the media. I'd like to preface my remarks on vaccine today in acknowledging the media who's attending. As I think we all appreciate in any event management, whether you're managing a single patient or a large population like Dr. Joyce Locks does with her team, there are three core components to that. One is, of course, coordination. The second is to engage the civil society in doing the right things. And fortunately, in Southwest Public Health, we've largely achieved that. And the third, of course, is good communications. And so I appreciate the role the media is having in this, particularly as we go into the issue of augmenting the self-protection measures that are very important in COVID control, and that is staying home if you're sick, hand washing when you're out in the community and as frequently as possible, social and physical distancing, and of course masking as an additional precaution. Vaccination is going to be our subject today, and we'll try to focus on that. And I accept that this is a very important conversation, so I'm looking forward to any of the media questions to either me or to Dr. Locke, appropriate to our areas of expertise. I did want to say that given the concerns about the vaccines related to their availability, their production, their safety, how they're used in what populations, that we should be giving a very reassuring message out to the general population. These vaccines were produced in an appropriate way with enormous international collaboration and extraordinary funding. And that is the reason why they became online so rapidly. They did go through all the appropriate regulatory processes for safety and efficacy. And as we would expect, as you roll out to a larger population, we are going to see things that weren't anticipated during the initial research and release of these agents. The expected side effects from vaccines are as we would all expect. That is the sore arm, maybe a little bit of muscle aching, some headache occurring in the hours after the vaccine, but rarely lasting more than 2 or 3 days, and often responding to simple measures such as icing or the use of Tylenol or other anti-inflammatories. Concerns that these vaccines could have wider spread impacts on the population are unfounded because of the nature of how they're produced. These are not whole viral or live viral particles. They're subunits that allow our own immune system to develop targeted responses to that which will allow us protection. They are as safe as any other vaccines would be expected that we do receive routinely. Tetanus, diphtheria, polio, the MMR vaccines, all of which have been highly successful and protected the lives of some of our most vulnerable populations. For the COVID vaccines, their rollout was targeted towards the most vulnerable in a strategy accepted not only locally but provincially and nationally. And we have largely achieved that for our long-term care residents and residential homes, where we've seen a marked drop in disease, and certainly hospitalization and death in that population has largely slowed. We've also targeted healthcare workers. The people in the front line who are exposed to virus also need to be protected. We needed those people to continue to be able to work without the fear of disease in the workplace. So I would pause in my remarks at that point and turn it over to the moderator to see if there are specific questions that we can help clarify from the media and help bring the message out to the community. Over.
Thank you very much. I will now open it up to questions. We have time for approximately 1 to 2 each, and I'll ask that you please remain muted until you are called upon. First is Ian McCallum, My FM. Ian, do you have a question for Dr. MacPherson about vaccine hesitancy or misconceptions that you'd like to ask, or for Dr. Locke? We'll come back to you, Ian. Next is Kathleen Saylor's Sentinel Review.
Hear me all right?
Yes, thank you.
Hello, sorry.
We can hear you, Kathleen.
Okay, sorry. Yes, I had a question for Dr. MacPherson. So our two, we have a long-term care home in outbreak and the hospital in outbreak, and I was wondering about the impact of vaccinations on those outbreaks. Are they blunting the impact of the outbreaks in these settings? Are they playing a role? And what might that outbreak look like if we hadn't had so many people vaccinated at this point?
Thank you, Kathleen. That's an excellent question. It's probably more appropriate a question for Dr. Locke, since it's her team who are investigating the outbreaks and do have a clear line of sight on how the staff have had uptakes on vaccines. I would support, as Dr. Locke's putting her thoughts together, I would support that healthcare workers, certainly in our institution here at STEG, as they've rolled out on availability to the vaccine, have had a high uptake. We've vaccinated over 70% of our healthcare workers with the first dose, and about a third of our healthcare workers have received both doses in a time that will give them full protection. So in my area of view, we've had great uptake, and as you know, at STEG, we've had a very good compliance in protecting staff from any nosocomial transmission. We've had no patients acquire infection in the hospital. We've had no staff members require infection in the hospital. So not only are our staff behaving well in terms of the public health measures recommended by Dr. Locke and her team, but they're also having a high uptake on vaccines, and we're achieving the outcome. We're protecting patients and we're protecting staff. Now, I think Joyce has her thoughts together. Thank you, Joyce.
Thanks, Doug. Christine, I'd say that what's the real sign here is that the vaccines are helping is that if you look at our new cases, we're beginning to see fewer and fewer new cases in our seniors, our elderly. Our vaccine coverage rates are good across the whole area in those 70 years and old, and we are definitely seeing that in the fact that we're seeing fewer new cases. Similarly, the number of outbreaks we've had in our long-term care homes and retirement homes now, as compared to during wave 1 and wave 2, is also much less, and we attribute that to the vaccines that have been rolled out in those locations. Wave 3 has been much harder than wave 1 and wave 2, and despite that, we've seen fewer of our seniors become ill, and fewer of our congregate living settings, such as the long-term care home and retirement homes, have outbreaks. So all good signs that the vaccine are helping us.
Wonderful, thank you.
Thank you, Kathleen. We'll now hand it over to Ian McCallum again at My FM. Ian, we still cannot hear you, so we'll move on. to Chris Abbott, Tilsonburg News. Go ahead, Chris.
Hello, can you hear me?
Yes, thank you.
The Tilsonburg Clinic, the mass immunization clinic, is administering the Moderna vaccine. How effective is the Moderna vaccine against the variants of concern? And is the supply of Moderna also ramping up with the general overall vaccine supply in the next week or two?
Okay, so I'll take that one. So the Moderna vaccine and the Pfizer vaccine, they're almost equally effective. The effectiveness of the first dose ranges somewhere between 70 to 90%. So it's a good vaccine, and for all, what we say over and over again is that we discourage people to do vaccine shopping. All the vaccines are effective, so the best thing to do is to get whichever one is available at the facility that you can get to easily. With respect to the Moderna vaccine, it is a little bit easier to use because it doesn't require the ultra low temperatures, and so we are using it in various settings. So you'll see it start to pop up in our local pharmacies, and some of our local primary care practices will start to have Moderna. So we do encourage residents to use whatever vaccine they can get a quick appointment to. We have a good supply for the coming weeks at the Mass Immunization Center in Tilsonburg, and do expect further shipments in May that will be coming to keep us well supplied at those centers. We also are waiting to hear about further doses that will be going to our region, to our local pharmacies, as that becomes available to them as well.
Okay, thank you.
Thank you. We will now open the line to Chris McMillan, Heart FM. Go ahead, Chris.
Hi, thank you for taking my question. My question is, what happens to the AstraZeneca vaccines that are at our at our local pharmacies right now? My sister got AstraZeneca. She says, "Give me the second dose now. I'll sign a waiver, whatever you want." Like I know the science, I understand the risks. So is that being considered, and what's happening with those doses that are still there, still in the fridges or freezers?
So the ministry has asked us to put everything on hold. So the ask to pause handing out AstraZeneca came out late yesterday afternoon, and so we're waiting for further guidance as to what happens to those doses. For now, they're just staying put everywhere where they are until the province gives us further direction. As to people like your sister, I want to reassure them that when it is their time to get a second dose, there will be a second dose. Right now, the provincial and the federal government have asked the National Advisory Committee on Immunizations to look carefully at research being done elsewhere on the globe about mixing and matching vaccine. So what is how well does it work if you had one type before and then get a different type after? We expect that research to come out, and whatever the findings are, we're committed to making sure that everybody gets an appropriate second dose when their time comes up.
Thank you very much. I'll now open the line to Rob Perry, Elmer Express. Go ahead, Rob.
Good afternoon, doctors.
Rob, you cut out there. Would you like to repeat your question?
Yes, sorry about that. I was just asking about the success of the pop-up clinic at the Ontario Police College, and given that, if any other one-day clinics are being planned for the N5H postal code, which is still lagging behind most, if not all, the other postal codes in the southwestern region in terms of vaccine uptake.
Thanks, Rob. That's a good reminder to all your listeners that anybody 18 years and older are eligible for the vaccine in the N5H postal code. And yes, we will be rolling out other pop-up clinics. More information to follow. We've had some very successful clinics so far with the help of the East Elgin Family Health Team, and we have some more in the planning. So stay tuned for that.
Thank you. I will
Thank you.
now, thanks, Rob. I will now open the line to Shane Ketnis, Rogers TV.
Hi, all my questions have been answered today. Thanks.
Excellent, thank you. We did also receive a question on social media that I did want to pose to Dr. MacPherson while we have him on the line. Dr. MacPherson, we've had several questions related to misconceptions around virus shedding. Can you please provide comment on that?
Thank you. That's a good question, and it's a valuable question to clarify. The vaccines are all subparticle or stimulating vaccines. None of them have whole virus in the vaccine, and none of them create any viral replication in the human host. So none of the vaccine can be associated with any viral shedding or viral production in the human host. And the only scenario in which that would occur is if someone was co-infected or co-exposed at the same time to a wild COVID virus, and they happen to be shedding just coincidentally to exposure to the vaccine. Over.
Thank you very much. That concludes. I have one more from social media. Sorry about that. An additional question for you, Dr. MacPherson. Is natural immunity from a COVID-19 infection more advisable than taking the vaccine?
No, to answer the question straightforward first, no, for a couple of reasons. One, taking the risk of having COVID disease and the consequence of that for hospitalization, intensive care, or death is still significant. We're still having about 2% case fatality across Canada and in Ontario. And of course, the vaccine safety profile, even with the recent concerns about the AstraZeneca vaccine, are still much, much lower than that. The duration of protection from the wild viral infection is not known, but it's unlikely to extend beyond 3 to 6 months if we know much about coronaviruses. Wild exposures did not produce long-lasting immunity. What is being seen is if you were one of the people who did have a wild exposure to COVID, that vaccination may actually boost your immunity and give you longer protective immunity from the potential of a second infection. So having had a wild viral infection is not a reason to not be vaccinated. It may actually be a good reason to get your vaccine. It may extend your protection. And the safety of the vaccines are clearly much greater than COVID wild viral exposure. Over.
Thank you very much. Is there anything else that you would like to add for our viewers and listeners?
To go back to my opening remarks, I think we need to acknowledge that the community is still a vital part of the containment and ultimate control of COVID disease in our area, and that engaging the community has been largely successfully done. We need to continue that messaging. We need to make it lively and fresh and engaging. We need to acknowledge that people have given up a lot during the last year and a half, and that hopefully with ongoing commitment that we will eventually be able to get ahead of this pandemic in a reasonable period of time. The projections on that, I will not put my neck out for that. I'll leave Joyce to do that. But I think that we still need to keep our eye on the goal. And even though the time may be variable, to congratulate the population for largely being compliant to the public health guidance in protecting themselves.
Thank you very much. And with that, we conclude today's media briefing. Thank you, Dr. MacPherson, for joining us today. And of course, also thank you, Dr. Locke. Have a good day, everyone.